Sasha and I'm from year 10. Today I'm going to talk about my biology project and it's about gastritis. What's gastritis? Gastritis is an inflammation, irritation, or erosion of the lining of your stomach, and it can occur suddenly or gradually. If you had gastritis before and now it's getting worse day by day or year by year or month by year month, meaning that it's getting chronic. What causes gastritis? Gastritis is caused by the irritation due to excessive alcohol use, chronic vomiting, stress, or the use of other medications. I know some of the patients really need to take in aspirins, but try to avoid if you can. If you can't, then I'm sorry if you have gastritis. Now, what happens if gastritis is not treated? Well, it can lead to severe blood loss and may increase the risk of developing stomach cancer. Well, most of you might think this is not so risky. Well, actually, you're risking your life. Now, what are the symptoms? Some people won't have symptoms, but nevertheless, here are some common ones: nausea or recurrent upset stomach, abdominal bloating, abdominal pain, vomiting, indigestion, burning or growling, feeling in the stomach between the meals or at night, hiccups, loss of appetite, vomiting blood or coffee ground-like materials, black, tarry stools. Now, you might go to a doctor and ask, how is gastritis diagnosed? Well, doctors review your personal and family medical history before they diagnose you. So here are some. Upper endoscopy. An endoscope, a thin tube containing a tiny camera, is inserted through your mouth and down into your stomach to look at your stomach lining. Blood test. The doctor may perform various blood tests, such as checking your red blood cell count to determine whether you have anemia, which means that you do not have enough blood cells. Fecal occult blood test, stool test. This test checks for the presence of blood in your stool, a possible sign of gastritis. Understanding your gut and digestion. Food passes down the gullet, esophagus, in the stomach. The stomach makes acid, which is not essential but helps digest the food. After being mixed in the stomach, food passes into the first part of the small intestine, the duodenum. In the duodenum and the rest of the small intestine, food mixes with chemical called enzymes. The enzymes come from the pancreas and from the cell lining the intestine. The enzymes break down, digest the food which is taken up, absorbed into the body. Now, how to prevent gastritis? These below should be avoided. Aspirin, if some of patients can't, it's a must to take aspirin, then use coated aspirins if possible. And smoking. Please avoid smoking or else you have gastritis. Caffeine and other caffeine-like substance. Don't take drugs. And also alcohol. Try to avoid these things and you will prevent gastritis. Now, diets for patients with gastritis. Don't worry if you're a patient with gastritis. Here are some diets. Food that contains chocolate, are spicy, or are high in fat may also irritate your stomach, so try to avoid them. For example, beverages. We have hot cocoa and cola. If you take hot cocoa, try to avoid it if you have gastritis. Whole milk and chocolate milk, same thing. And spices and seasonings. I know some Malaysians might be so addicted to spices. Well, you have to avoid it if you're a gastritis patient. You have to avoid black and red pepper, garlic powder, chili powder. Here are some examples. You can try more on Google. Here's a little something that I liked a lot by Tori Amos. These are words of wisdom. Healing takes courage, and we all have courage, even if we have to dig a little to find it. And if you have the courage, you can heal. People might think, oh, I have no courage. That means I'm not gonna heal. I'm so worried. I'm having sickness. This, that. Come on, people. We all have the courage. We all have it inside. We just need to dig a little bit to find out our courage. I know some people like, no way. I have no courage. I'm not gonna care. I'm not gonna dig in to find courage because courage helps you heal. So, guys, what will I do next? I'll be doing another YouTube video, but maybe another topic. Anyways, I would like to say thank you for watching, and I guess I'll see you guys another time. Bye!